For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. We have 2 guests here today to talk about healthy choices, population health, and living a healthier lifestyle in our community. Our first guest is Dr. Christopher Foret, a physician at our St. Tammany Physicians Network Folsom office. Welcome, Dr. Foret.
Hi, Amanda. Thank you. Thanks for having me.
So can you first give us a little bit about your background as a physician?
Sure. I'm a physician. I've been with St. Tammany Parish Hospital for 15 years now. I've been in the Folsom office. I've been in private practice practice of medicine for 22 years as of August. And have various interests in population health has become one of mine.
Okay. And so can you explain what population health is?
Population health is another view of our health care in the United States, but it's based on a population standpoint. It's using information about specific populations from ethnic groups and the population of a region or state as a whole to help determine interventions or ways to improve the health care of our population as a whole.
Okay, so it's kind of starting, rather than treating people, preventing them from even needing treatment.
In addition to doing individual treatment of acute problems, it's trying to figure out a way to prevent problems from occurring. The United States healthcare system is broken, as I think we all know. It's expensive. These are mechanisms to have a healthier population in a value-based approach and increase lifespan and happiness, among other things.
Okay. And so what is St. Tammany Parish Hospital doing in the realm of population health?
St. Tammany Parish Hospital has been on the forefront of this. These programs really began within the last 10 or 15 years with a Healthy People 2020 initiative through the federal government. St. Tammany has embarked on a population health program within the last 8 years. One thing that began is the St. Tammany Quality Network. This is a group of 280 physicians approximately that is pursuing value-based care. Reducing cost of joint replacements is one example. Trying to meet benchmarks for control of diabetes, hypertension. Trying to ensure that people get mammography or mammograms on time, colonoscopy when they're supposed to. Also meeting other benchmarks with childhood vaccinations and adult vaccinations. Part of the objective is to keep people healthy and keep our population healthy.
Okay. And so what are some of the, you mentioned, reaching out to the community and keeping the community healthy. What are some of the mechanisms of that outreach?
One mechanism is education. It's having lectures for the community. It's also offering diabetes education through various offices, dietary education with nutritionalists, also smoking cessation classes. Those are some. Additionally, there are mobile outreach programs, screening breast exams, screening rectal exams for prostate cancer, and also talking to various groups about population health initiatives.
Okay. You mentioned a couple of issues just now. What are some of the biggest, acute issues that you are seeing in the community that we kind of can address before they become problems?
2 substantial disease processes are diabetes and hypertension. Okay. Way these things can be addressed is by individual choices or healthy choices. Healthy Choices is another program that's been embarked on by the St. Tammany Quality Network.
Okay, and so can you explain a little bit about what that program will be?
A Healthy Choices program actually has its origins from another part of the state. There was a physician in a very small town in south central Louisiana who developed a program in conjunction with a grocery store where they went in and marked certain foods as a healthier choice. We've tried to, or in the process of embarking on that program in our area, to help people give a guide of what would be a better nutritional option and a healthier option. For example, low sodium or low salt option for people that would have high blood pressure. They could say, okay, this is a healthier choice than doing something else. And we're excited about this possibility. We're excited about the opportunities because the best health care is for a healthy patient, and people making choices on the front side will help them be healthier later.
Right. So is this kind of just a way to make it easier for people? Because I know we all want to think we know what's healthy, but we maybe really don't.
I think it absolutely is. And Stacy will talk to you later and show you some of the emblems that we will have in stores. The less that we have to think about things, probably the better we are off with it. And so I think it's definitely a segue to that. As I told a diabetic yesterday in my office, everything is controlled. Nobody eats things they shouldn't in my office. Nobody's drinking in my office. Nobody's smoking in my office. Unfortunately, they can't live in my office.
Right.
They go out and have to make individual choices. And this is a tool that we can use to help them make a healthier choice. They benefit, and we all benefit as a society.
Right. And I guess that's a good point. Is as the community gets healthier, does that lower the cost of healthcare overall for everyone?
Absolutely. Absolutely.
Okay. I guess, so what are some things that people at home can do to pursue a healthier lifestyle?
I could think of two easy things in theory, but in practice they're a little more difficult. Stacy will go into more detail from a diet standpoint, but it's making healthier choices when one eats. When eating at a fast food restaurant, for example, getting a salad, getting a grilled chicken sandwich, when going to a restaurant, ordering an entree and asking to put half the entree in the box before you ever get it.
Right.
Some of the restaurant servings are four adult servings for an entree, and if you're like most of us, what's on the plate gets consumed whether you're hungry or not. From an exercise standpoint, it's not as regimented as someone may think. Historically, we've been told 30 minutes 4 days a week. Then we were told 15 minutes 4 days a week. Now it's just move 2 to 3 hours a week. And it doesn't matter how one gets to the 2 hour mark, just get to the 120-minute mark. Okay. For example, I started 0 on Saturday. And if I do 37 minutes on Saturday, I have 83 minutes left for the rest of the week to get to 120 minutes. So it's just move.
Right, just moving and eating healthier. You mentioned smoking. Is that a big issue with just keeping you healthy?
It is, because it contradicts everything we try to do in the chronic disease management. Mm-hmm. There's not one thing that is positively impacted by tobacco abuse, certainly in diabetics, certainly in people with coronary disease, certainly in people with high blood pressure. And some studies have shown that people who smoke have more chronic pain than people who don't.
Oh, wow. And I think it's a lot of us grew up knowing that smoking was bad, and you think it's not as big of a problem as it actually is, correct?
I think it's a huge problem.
Right.
And I think that most of us have an inherent knowledge of what's good and what's not good, but it's making the modification and the approach of how do I change it. Mm-hmm. It's hard. And case in point, from a dietary standpoint, there's an advertisement on television that you can get this much food for $5. There's not one meal at my house that's prepared that costs less than $5.
Right.
So we have to overcome that. We have to overcome the mentality. We all know smoking's bad, but what can we do? Have a plan. How do we change it? How do we make these changes? And it's common to hear historically, I'm going to go on a diet. Well, diet's a fraction of this, and I think diet's an antiquated term. I think the approach needs to be embarking on lifestyle changes.
Right.
It's a bigger picture thing, because diet will help lose weight, but exercise helps maintain weight loss. Okay. So I think we need to look at it globally, individually. I think we do from a population standpoint, and I think we need to be responsible for our health care to an extent.
Okay. And if someone, say, has decided, I want to get healthy, I don't really know what issues I even have at the moment, but I want to get healthier, do you recommend they establish a primary care physician, even to just reach out to a physician and get a physical and see where you're starting? Do you recommend that?
I think so. I think that our healthcare studies have shown time and again that people who are engaged with a primary care physician have better healthcare outcomes, and in a more cost-effective manner too. And certainly cost is not everything, but it's a huge thing. With the rising cost of health insurance, this is a way that can get from it. And primary care physicians, as studies have shown time and again, have better outcomes, or excuse me, as good of outcomes in a cost-efficient manner. People should see physicians, and they should strive for access. And also it's the reinforcement. Yes, I'm doing well. We always like to hear positive reinforcement, and then we can see it tangibly. And the people who are engaged and do these things do better.
Right, and then you kind of can catch things early if you do have something.
Absolutely.
Because you can't treat something if you don't know you have it.
Absolutely, no question.
Exactly. All right, well, thank you so much for being here. I appreciate it. I look forward to talking with Stacy. Up next, we have one of our diabetes educators here to give us a little more detail about how to live a healthy lifestyle and where to start.
Thank you. Thanks. Thank you. Thanks for Sunny Face Eggs. For my baby sister.
For my fishing buddy.
Thanks for my mama's gumbo. Thanks for my mom.
We enjoy receiving awards and recognition from our peers, but the true reward comes from seeing positive outcomes for our friends and neighbors. So thank you for trusting us. St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is Stacy Lanoux, a registered dietitian and diabetes educator at St. Tammany Parish Hospital. Welcome, Stacy.
Thank you.
Can you give us a little bit about your background?
Sure. I've been a registered dietitian for 22 years. I've worked in all of the different facets of the industry, and I specialize in diabetes, both in outpatient, inpatient, consulting, and community outreach.
Okay. So as a diabetes educator, I know Dr. Foret mentioned that diabetes is very prevalent in Louisiana and one of the biggest diseases that can be controlled with healthy eating. Can you talk a little bit about diabetes?
That is correct. Diabetes is growing at an epidemic rate. There's 30 million people in the United States that have diabetes, and 15.3% of the people, the adults in Louisiana, have diabetes.
Wow.
So that's 575,000 people. And we spend billions of dollars each year managing diabetes, when it is something that can be controlled by healthier choices and being more active.
Okay. So I guess, can you start a little bit with some details about the healthier choices? I know we've talked in the past about the 3 main macronutrient groups. Can you kind of tell us what that is and go into a little detail, please?
Yeah, it's really simple. It's not as complicated as you would think it is as far as diet, and it's really not a diet. It's more of a healthy eating plan. And I like to explain it as basic nutrition 101. There's 3 macronutrients. You have protein. We think of protein as meat. Healthier choices would be the white meat of the chicken, turkey, fish, high in omega-3 fatty acids. That'll be your tuna, salmon, mackerel. It's those deep water fish that swim in cold water. It's the extra protective layer of fat that they have to swim in the deep cold water is where the omega-3 fatty acids are. So even if it's in a can, make sure it's packed in water. Tuna, salmon, chicken, less expensive, more economical, still is healthy.
Okay.
And then moving on to your grains, carbohydrates. Carbohydrates come from grains, fruit, and milk. Making sure that you're choosing whole grains, the brown rice over the white rice, the wheat pasta over the white pasta, or even getting your carbohydrates from things like sweet potatoes or beans. Okay. And remember that fruit is also carbohydrate, and I'd rather see my patients get their fruit from the whole fruit rather than the fruit juice. Okay. Not that juice is bad, because there's no bad food. It's all about the amount. Okay. And with your fruits and vegetables, a little tip that I give is through and through color. So think about a blueberry. It's blue on the inside, it's blue on the outside. The fruits and vegetables that have through and through color have more antioxidants, more vitamins and minerals. So that's just a good little tip.
Yeah, I've never heard that before, so that's a good one.
Yeah, and then for your Vegetables. I always follow the plate method with my patients, making sure that it's about a 9-inch plate. Half of the plate is filled up with non-starchy vegetables. These are things like Brussels sprouts, cabbage, celery, onions, okra. I could go on and on, but they're the non-starchy vegetables, not the potatoes, not the corn, not the peas, okay? And those are the things that have the brighter colors. The brighter the color, the better.
Okay. And then you mentioned protein. What about the red meats and that sort of thing? I know you mentioned the healthier ones, but is there a room for those other things in your diet?
Yes. The ADA recommends 3 to 5 fish meals a week, but red meat, if it's lean, just remember loin means lean. So sirloin, tenderloin, even if it's pork, that's okay as long as it's got loin in it.
Okay.
And make sure you're removing all the excess fat from the edges and choosing the leanest possible.
Okay. And so what are some other behavioral strategies that people can use to achieve weight loss, and I guess not so much diet, but change their lifestyle?
Okay, yeah, I love going over these with my patients and challenging them with them. I always tell them it's their homework. And a few of the things that we go over is, when you eat, make sure you're sitting at a table.
Okay.
Make sure you're not in front of the computer, you're not watching TV, you're not driving in your car.
We're all guilty of those things.
Exactly. You're sitting at the table, and when you use a fork, use the smaller fork, not the larger fork. Use the smaller fork, and each time you take a bite, put the fork down in between each bite.
Okay.
And then chew each bite 25 to 30 times. Most of my patients come back and say, doesn't last past 20.
Oh, wow.
But what that does is it slows you down. It makes you not eat so fast, and it makes you feel full faster. And also listening to your physiological hunger. So we eat for a lot of different reasons.
Right.
We eat because we live in Louisiana and the food is good. Mama taught us to clean our plate.
Right.
We eat we don't gather without eating.
Right.
You know? So when you sit down to eat, if your stomach should be hungry. If your stomach's not hungry when you sit down to eat, that means you ate too much the meal before.
Okay.
So if you listen to that, and once you sit down to eat, if you take 3 to 4 bites and put that fork down, chew each bite 25 times, after you get past 3 or 4 bites, that hunger is gone. But we keep eating because we have to clean our plate. So doing things like Dr. Foret mentioned, you know, when you're eating in a restaurant, getting that go box when they bring your plate, or having them put half the portion on the plate, because they do. You know, McDonald's has supersized us all. You know, the amount of fries that we should have is the amount that's in the kiddie fry. You know, the large fry is 3 portions.
Wow. Okay. I know you mentioned earlier kind of the economical standpoint, and that there are still ways, because I think a lot of people always think, I mean, if you want to be healthy, you have to, you know, go to the fancy grocery store and buy all the organic, everything that's, you know, which most of us can't afford. Right. So can you talk a little bit about the kind of choices you can make that maybe are more economical for families?
Sure. Yeah, sure. You can buy the store brand of products. They're just as good as the name brands most of the time. You know, you want to look for things that don't have as many additives. You know, there's so many. If it has more than 5 to 8 ingredients, it's too many.
Okay.
You know.
I know something else that people have talked about in the past is kind of sticking to the outskirts of the grocery store. Is that something that you recommend?
It is something that I recommend, but there are good foods on the aisles of the grocery store. You know, the olive oil is on the aisle, right? You know, and that is something I wanted to touch on, is the fats. Not all fat is bad. Olive oil, canola oil are the best oils to use. Flaxseed, grapeseed oil, and those omega-3 fatty acids. So if you're cooking, make sure if you're not using your spray olive oil, Make sure it's canola oil, and watch the amount.
Okay. I've always been curious about that too. Do you recommend that the spray isn't as good as just plain olive oil, or does it really matter?
The olive oil spray is the one that I prefer.
Okay.
But even if you can get your own pump and put olive oil in your own pump,
Okay.
that's what I prefer.
Okay. So we talked a little bit earlier about y'all going into the grocery stores and kind of picking out healthier foods. Can you talk a little bit about that?
Sure. We've partnered with some local grocers, and I've gone through the stores and have some guidelines that are just some healthy guidelines. A couple of those things are, the sodium contents under 600 for meal items and under 300 milligrams for a snack item, limiting the saturated fat to no more than 3 grams, minimal to no artificial sweeteners, and then looking for things that have at least 2 to 3 grams of fiber or more. And we will be putting this logo next to the tag on the shelf, just to indicate that this is a healthier choice.
Okay. And all of these healthier choices are going to be determined based on these guidelines by either you or Dr. Foret or another dietitian. Okay. So when patients see this, they can know that it's a healthy choice and something that will be better for their families. Okay, great. I guess being a diabetes educator, can you just talk a little bit about, is this kind of what y'all do with your patients to kind of combat diabetes and maintain it?
It is. I work at the Folsom Clinic and also work at the Covington Clinic, and I see patients of all ages. I see patients that are in their 30s that have been diagnosed with diabetes, and that is very, very young. And every year it's getting younger and younger and younger. And we can definitely prevent that. And I've had patients come to me and their blood sugars are running very, very high. And eventually, by doing these dietary changes, becoming more active, they've gotten off of their medication. They've totally changed.
Wow. Okay. Well, great. Well, thank you so much. Is there anything else that you wanted to mention about nutrition? No? All right. Awesome. Well, thank you so much. I'd like to thank Dr. Foret and Stacy for being here to let us know about the new Healthy Choice program and nutrition. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.